All right, let's get right into it. When you get sick, the last thing you should have to worry about is whether getting better will bankrupt you. But for millions, that's exactly the choice they face. Today, we're going to break down a really important study that exposes a huge gap between the official story on healthcare costs and the reality on the ground. So here's the central puzzle. You look at the official global statistics, and they suggest that in some of the world's lowest income countries, say in West Africa, the financial burden of healthcare is, well, manageable. It paints a picture that, frankly, doesn't seem so bad. But that just doesn't feel right, does it? So what's really going on here? To get to the bottom of this, we've got to first look at the main statistic everyone uses, and then we'll see why it's so incredibly misleading. Okay, so the world tracks this problem using something called catastrophic health expenditure, or CHE for short. The idea is pretty straightforward. If a family has to spend more than 10% of their entire budget on healthcare, it's considered a financial catastrophe. This is the official yardstick. And according to that yardstick, in the West African Economic and Monetary Union, just under 10% of people are facing this kind of catastrophic spending. Now, on the surface, you might think, okay, 10%, that's bad, but maybe not as widespread as I thought. But that number doesn't just hide the truth, it misses the entire point. And here it is. This is the fundamental flaw. The official metric only counts people who actually spend the money. It completely ignores anyone who can't afford care in the first place. Think about it. If your pockets are empty, you can't spend 10% of your budget on a doctor. You just don't go. You stay sick. And because you didn't spend any money, you are completely invisible to the statistics. So the researchers behind this study basically said, this is absurd. We need a new yardstick, one that measures the problem as people are actually experiencing it. So they built a much more complete picture. It still includes people who face catastrophic or impoverishing spending. That's still important. But they added this single most critical missing piece. People who needed medical care but had to go without it simply because of the cost. This is the game changer, right? It measures both the hardship from spending and the barriers that prevent spending in the first place. It sees the whole story. And when you measure what actually matters, well, the picture changes. A lot. This isn't just a small adjustment. It's the difference between the official story and the lived reality. So remember that official number, the one that makes the problem seem contained. Just under 1 in 10 people. Keep that number locked in your head for a second. Now, here's the truth. When you include everyone who is either spending too much or is forced to forego care because of the cost, that number skyrockets to nearly 40%. Let that sink in. Nearly 4 in 10 people. We're not talking about a small discrepancy. It's a completely different reality, one that is 4 times worse than the official estimates. And you can see it right here in the data from the study. This chart lays it out perfectly. If you look at the bar for overall financial protection, you can see it hitting that 40% mark. Now compare that to the much, much smaller bar for the official catastrophic spending metric right beside it. The visual gap is it's huge. Okay, so you might be thinking, what about the classic solution everyone talks about, health insurance? Well, this is where the story takes another turn. It turns out, insurance in this region is a real paradox. Let's break this down. For the very few people who actually have insurance, the good news is it works. It helps them. It lowers their chances of having to skip care, and it cuts their costs. But here's the bad news, and it is a massive deal breaker. Almost nobody has it. The coverage rate is a tiny 5.7%, and it's mostly held by the wealthiest people. This chart from the study shows you exactly who has that insurance, and it's stark. Each of those dots is an insurance scheme. The further to the right a dot is, the more that insurance plan is concentrated among the wealthy. And as you can see, all the private job-based plans are jammed way over on the right. It's a system that protects the people who need protection the least. And this visual says it all. More than 94% of the population is left out. So sure, insurance is a great lifeboat, but it's only available to a tiny handful of passengers, and most of them were never in danger of drowning to begin with. At a system-wide level, it's a total failure. So where does all this evidence lead us? Let's get to the study's conclusion, because it's about as direct and unambiguous as it gets. The verdict is in. So-called contributory insurance, the kind where people are expected to pay premiums, is simply the wrong tool for this job. It's designed for formal, stable economies. In places with tons of informal work and widespread poverty, the model is, to use the study's own words, structurally misaligned. It has failed. Period. But the evidence doesn't just diagnose the problem, it points toward the cure. The authors call for 3 essential ruptures with the way things are done now. First, stop relying so much on contributory insurance. Second, go all in on building up tax-funded public systems that treat healthcare as a right. And third, make sure essential medicines are covered, since they're a huge part of the cost. Basically, it demands a fundamental pivot away from a pay-to-play model and toward a universal system. So, the bottom line is this. The current strategy, when you measure it honestly, is leaving 4 out of every 10 people behind. The data isn't just suggesting we tweak a few things. It's demanding a complete change of direction. The goal can't be to find a model that works for a few. It has to be to build one that protects everyone. And the first step is to start measuring what actually matters.